on the web, and in your hands. This is MDiTV.
You're watching this video on your computer or mobile phone or PDA, so you probably know all about Twitter, right? It's all the rage among celebrities, politicians, and businesses trying to extend their communication reach. But there's an industry that's lagging behind. I'll give you a hint. It's the industry that's still trying to figure out how to use email. And it relies on faxing paperwork. How many faxes do you send these days? That industry that's still so 20th century is healthcare, of course. The Chief Information Security Officer at Oregon Health and Science University, Dr. Ronald Markham, says one reason for the reluctance to jump into social networking technology is that confidentiality and patient trust must come first.
By its very nature, social networking is a very public forum, and it is an inclusive media rather than an exclusive media. Now, from some business perspective, that may be fine, but if you're a patient and there's confidentiality involved, that may not be fine.
While many doctors are not using social media professionally, one New York pediatrician is taking full advantage of Twitter for her business.
Twitter is a great way to get your message out to a large number of people all across the world with very little effort. Less than 140 characters, and you can be giving advice to people from different countries. It's been a wonderful way for me to grow my business and social networks.
But Dr. Joanna Dolgoff is quick to say she only gives very general advice on her Twitter site. It's not for direct doctor-patient communication. She says her colleagues won't even go that far.
The doctors that I know around me tell me they want nothing to do with Twitter. I can't believe you're doing that. It takes up so much time. None of them want to be on Twitter. I've invited many of them to come on Twitter to learn about it. So far, the doctors I know really have no interest. I believe it's because for them, they don't see the local uses. You know, they would want to build their own practice. They're not interested in being like the national child obesity expert as I am. They are more interested in building their local practice. But the truth is, you can still get in touch with a lot of local people on Twitter, and they don't really see that.
Dolgoff predicts that eventually doctors will be on Twitter and Facebook. Ronald Markham is more cautious.
Well, I don't think that we know the full benefit or hazards of this particular technology, primarily because it's a work in progress, if you will. The technology is rapidly being developed, the capabilities are rapidly being developed, and I think you have to look at those individual elements as they become available.
While doctors try to figure out the proper role for online social networking, the marketing departments of a few major healthcare systems are signing on. The Mayo Clinic, Johns Hopkins, and Mount Sinai Hospital all have a presence on Twitter, Facebook, and YouTube. After all, that's where growing numbers of their patients are spending more of their time.